Depression in the elderly, how to help our seniors. Introduction. Basically, depression is an ordinary psychological disorder characterized by high tempers, interest failure, and loss of happiness. In addition, it is characterized by thoughts of shame, low self-esteem, troubled slumber, low vigor, and reduced attentiveness. The mentioned troubles may continue or recur and may make the depressed persons have considerable mutilation of their ability to pay attention to daily tasks. In extreme cases, depression may cause depressed persons to commit suicide. Depression is linked to the loss of approximately 850,000 lives annually. As a matter of fact, depression is the chief cause of disability and a major cause of universal poor health today. Antidepressant prescriptions and planned psychoanalysis are successful for the majority of those who have contracted depression. The drugs are available and may be found at prime care centers. Obstacles to efficient care are such as inadequate resources, a short supply of trained providers, and societal disgrace linked with psychological disorders. Prime care programs meant for depression improve the care experience, pleasure, well-being, performance, monetary output, and domestic prosperity. Depression among the elderly. Many of the problems that the elderly face, for instance, the death of their half-best, may trigger depression, particularly among those lacking a brawny sustenance scheme. However, depression is not a crucial component among the elderly. Depression normally makes the elderly not take pleasure in life as fully as they would wish and normally does pose a serious threat to vigor. Actually, a small portion of the elderly access the assistance they required despite depression being a regular setback. The motives as to why depression in the elderly is frequently disregarded include the fact that many people take for granted that this despair is simply a fraction of growing old. Furthermore, the elderly are repeatedly cut off from communal activities and very few people are available to discern their anguish. In most cases, medical personnel usually assume depression in elderly patients and as a substitute give attention to physical suffering. Lastly, some depressed elderly persons are unwilling to converse as regards their thoughts and need for assistance. This may result in undesirable outcomes which comprise depression. If depression is not accorded proper medical attention, it may lead to grave health threats for elderly adults, especially those who are fond of alcohol. However, with proper cure and assistance, the depressed elderly may recover in time. Reasons behind depression among the elderly. One of the causes of depression among the elderly is seclusion. Many elderly people are often left alone when the young and energetic group goes around their usual daily duties. This leads to feelings of neglect and worthlessness which ultimately leads to depression. Another possible cause of depression amongst the elderly is the condensed logic of aim. This is characterized by thoughts of worthlessness or identity failure because of sequestration or physical confines. Health issues may also be a major contributor to depression among the elderly. Prescription is another contributor to depression among seniors. Some medical prescriptions make depression worse. In addition, fright is another contributor to depression in the elderly. Fright at times strikes due to fear of demise, nervousness over monetary troubles, or vigor concerns. Lastly, current life struggles among their sons and daughters contribute a lot to depression. These struggles make the elderly people in our society change their way of thinking and emotions. This means the struggles and demise of associates or loved ones is a major cause of depression, especially when it involves a life partner. Signs and indicators of depression among the elderly. The signs and symptoms of depression amongst the elderly are grief, exhaustion, ditching attention in leisure activities, communal exclusion, and loneliness which make them unwilling to socialize with allies. Another indicator is a lack of sheer determination to take part in functions, body weight reduction, and loss of appetite. Slumber turbulences which include complexity in having good sleep, sleeping for too long, and daytime drowsiness are signs of depression. Loss of self-esteem is brought about by doubts concerning loads and thoughts of insignificance. Finally, other signs include amplified alcohol consumption and/or associated drug substances and homicidal feelings or efforts. Ways of helping the depressed elderly. There are several ways of assisting the depressed elderly. One of the easiest ways is incorporating them into our daily activities which cater to psychological and physical needs. This is because depression is improbable when the thoughts of the elderly are dynamic. Such activities include visiting zoos, national museums, and hiking. Another way is by planning regular communal activities. Such actions include faction excursions, making trips to allies and extended family members, or trips to the local society centers. Preparing balanced diet foods is also helpful in maintaining their physique since a meager diet may make depression worsen. We should also cheer up the depressed elders and encourage them to follow medical prescriptions to the letter. This is important because depression persists, especially if treatment is terminated abruptly. We should also observe suicide caution signs by looking for instant expert aid if we doubt our elders are thinking about committing suicide. Depressed elderly persons may also take the initiative of dealing with their conditions. Depressed elderly may choose to use their time in charitable functions, taking care of home animals, cracking jokes, and telling tales. In addition, they may engage in frequent exercising to maintain their strength. This may involve regular visitation to gymnasiums and other sporting facilities such as badminton, lawn tennis, and even pool centers that are reachable at minimal cost. Employment of maintenance meetings for depressed individuals may also mark an important milestone as far as combating depression amongst the elderly is concerned. It encourages the elderly to bond with other individuals who are going through the same tribulations. It also makes them secure and therefore feel safe to contribute their experiences for guidance and support. Medical matters that set hurdles to depression must be dealt with as soon as possible. To minimize the fatalities associated with depression, it is very important to adhere to the prescribed medications and therapies without any abuse whatsoever. This is the only way of making the world free from any depression-related fatalities and making the elderly lead a meaningful life. Conclusion. It is apparent that the consequences of depression are lethal, and it is a noble thing to offer depressed elderly persons proper medical attention as soon as possible. Antidepressant prescriptions are one of the best and most recommended ways of fighting depression. This prescription may aid in relieving the signs of depression. Another important form of treatment for the elderly suffering from depression is counseling and rehabilitation. Lastly, compassionate counseling for the elderly such as spiritual and peer therapy may be very useful for the depressed.